The Florida State University student allegedly found trying to bite off a man's face after stabbing him and his wife to death in their home earlier this week was, according to local authorities, abnormally strong, with several deputies, a taser, and a police dog struggling to subdue the 19-year-old who shed clothing during the attack and made animal sounds. The suspect remains on a respirator in life-threatening condition, and police are awaiting full toxicology reports, but they suspect a drug called Flakka is involved. So what is Flakka exactly? Dr. Indra Cidambi, an addiction expert and medical director of the Center for Network Therapy, joins us now to discuss. Welcome, Dr. Cidambi. Thanks so much for being with us. We recall bath salts being in the news in 2012 with a similar horrific incident. Is Flakka related to bath salts?
Yes, it is. Flakka is a designer drug, and it has alpha PVP, which is a cousin of cathinone. That is the chemical, synthetic chemical that's present in bath salts. So the similar kind of similar effect is what you're seeing with
And you
Flakka.
said earlier that bath salts is a sort of a synthetic form of marijuana, and Flakka is like a synthetic form of cocaine? Is that?
Flakka is a synthetic form of cocaine, and
Right.
K2 is a synthetic form of marijuana.
So then does Flakka react on the brain like cocaine, just times what?
10 times more powerful.
Oh my
the
goodness.
same way that cocaine acts. It's a stimulant.
It's a stimulant. And so the description of somebody growling or seeming to thinking they have superhuman strength, does that sound like the kind of side effects that Flakka creates?
Yeah, if you have to look at Flakka acts on two different neurotransmitters. One is the dopamine, which is the pleasure kind of reaction, so you get euphoria, and the second one is a norepinephrine, which is adrenaline rush, layman's voice. So when they get that rush, you become very powerful and so much of strength in them. The temperature goes high, so they rip off the clothes and run naked. That's what you see.
And do they start
violence.
hallucinating as well?
Yes, they hallucinate, and that's what you saw with animal sounds and stuff like that. And they become self-injurious, and they can become extremely violent. That's called excitement delirium.
And where is Flakka coming from? And are you seeing it here on the East Coast as well?
Typically, it's been on the internet. You can buy it online. It's been manufactured and sent from China.
Oh my goodness.
So recently, I've had exposure to Flakka website through one of my patients, and I got that education, and I was speechless when I first found out what it was.
And it's very inexpensive, correct?
It is $5 per hit.
$5 a hit.
Right.
So is this a growing epidemic? Are you seeing more of it?
It's more of it right now because, it's so easy. Mm-hmm. It's being cheap, $5 a hit, and they can buy it in a bulk. So it's easy to buy and easy to use. So, that's what people are running after.
This is really terrifying. So tell us, is there any counter medication for Flakka?
Unfortunately, we don't have any detox medication as the same kind. If somebody uses cocaine, we don't have any medication to treat them.
Right.
For detox. The same thing with the stimulant here. We don't have any medication, but we can do all kind of cognitive behavioral therapy and those things. But the distractibility is very high. They can only pay attention for 20 minutes. So it has to be a lot more work with these patients.
And so if you suspect a loved one may have been taking Flakka or is developing an addiction, you say it is a very addictive drug, correct?
It is very addictive because it creates a lot of cravings and urges in them, and they keep using it. And they also crash when they don't, they come off of Flakka. It's a crash. They get depressed, they're anxious, they're tremulous, and then they're not sleeping well. So it makes them also psychotic at that point in time. So they want to get better, and they keep
taking
using it.
So what can we do for loved ones who we suspect may be having this problem?
Get them for treatment. It is a therapy, which is that's most important. And also really watch out for warning symptoms.
Right. What are the warning symptoms? Just this behavior you're discussing.
Yeah, absolutely.
Dr. Cidambi, thank you so much for that. Very frightening stuff.